When people talk about skin cancer, the type that most people think about is melanoma. This skin cancer follows the ABCDE rules for diagnosis. A, asymmetry, B, a regular border, C, more than one color, D, diameter more than 6 millimeters, and E, expanding in size. However, these rules will not help to find the most common type of skin cancer, called a basal cell carcinoma. Unlike melanomas, basal cell carcinomas are often symmetric, with regular borders in the early stages. They are usually one color, being about the same as the surrounding skin, but with a pearlescent sheen, although they can be reddish or bluish in color. On darker skin tones, they may appear lighter or darker than the overall skin tone. They often start off as bumps with a rolled border or can have a warty-like appearance. They are also fairly slow growing and can be smaller than 6 millimeters when forming. As you can see, the ABCDE rules are not helpful for diagnosing this type of cancer. Basal cell carcinomas account for nearly 80% of all skin cancers and is the most common type of cancer in the world. However, they are rarely fatal, tend to grow slow, and do not tend to spread to other areas of the body. Although, if left untreated, may grow deep and spread out from where they started. They are commonly found on sun-exposed areas of the skin, such as the neck, arms, and face, especially on the nose and ears. Basal cell carcinomas are most common in elderly males, especially in fair-skinned people with blonde or red hair. One example is farmers who typically spend many hours out in the fields working in the sun. They often wear baseball caps, which protect their foreheads and scalps, but leave their neck, arms, nose, and ears exposed to the sun, where they are more likely to have a basal cell carcinoma occur. Another example would be truck drivers. They would most likely have a basal cell carcinoma on the left arm and left side of their face versus the right, due to that being the side most frequently exposed to the sun. As a basal cell progresses, they can develop a central depression that often scabs and bleeds. Oftentimes, there are thin red lines visible on the edges of a basal cell carcinoma. Those thin red lines are small blood vessels that can bleed when bumped or scratched. When someone comes to the doctor and describes having a sore that does not seem to heal, a basal cell carcinoma is often on the list of possible causes to rule out. Do not just follow the ABCDEs for skin cancer detection. No matter what the spot on your skin looks like, if you are concerned, tell your doctor to take a look. It could be one of the other types of skin cancer. Your skin will thank you.